joining us today. I'm Jessica Farringer, the Associate Director for Data for Impact. And for those of you who are unfamiliar with Data for Impact, Emily, can you flip to that slide that has the D4I info on it?
Yeah.
Thank you. And then we can just go back.
Okay.
So for those who are unfamiliar with Data for Impact, or D4I as I'll call it, D4I is a 5-year cooperative agreement that was awarded last September by the United States Agency for International Development. And D4I works to, as you can see here, generate strong evidence for program and policy decision making, build individual and organizational capacity, and enhance the use of data for global health programs and policies. So today we're talking about use of a qualitative method called process tracing. This webinar is the first in a series that Data for Impact will be hosting on use of complexity-aware methods in evaluation of public health programs. And we've invited our two colleagues here, Dr. Emily Bobrow and Heather Davis, to share with you lessons learned through their adaptation and implementation of this method in public health evaluations in Uganda and Madagascar. So to introduce our speakers, we have Dr. Emily Bobrow. She's a Senior Technical Specialist for Evaluation and Learning at Measure Evaluation. Dr. Bobrow has nearly 20 years of technical and programmatic experience in international public health. She's designed and implemented numerous public health programs and implementation research studies, and has provided evidence to support practical interventions. She leads the Nutrition Assessment, Counseling, and Support, or NACS as we call it, and PMTCT portfolios, and she led the team that conducted the PHFS evaluation you will hear about today. We also have Heather B. Davis with us. Heather is a research program manager for Measure Evaluation, including also the PHFS country assessments activity you'll hear about, and other activities in the NACS portfolio. For over 15 years, Heather has led strategic planning for HIV programming in several countries, and she has a deep contextual understanding of challenges from facility to national levels. She supports qualitative research development, implementation, and analysis, as well as quantitative research implementation. So with that, I will hand things over to you, Emily, and I understand Heather will moderate our question and answer session following Emily's presentation. Thank you, Emily.
Thanks, Jessica. All right, so as Jessica said, yeah, I'm gonna do the presentation. This is Emily, and then Heather is going to moderate the Q&A at the end. And you'll see on the Zoom platform, I know lots of people are writing in the chat function, which is great. It's great to see how many people are here from all around the world. But there also is a button there that says Q&A. And if you have questions throughout the presentation, please put your questions there. Heather will be looking at those and making sure that we get to those. I'll leave time at the end to make sure that we do answer questions. We are recording this session, and everyone who is registered, attending and registered, will receive a link to the recording and the slides as well. Okay, so just to get started, it's great to have so many people interested in process tracing. I am somewhat new at this method, so I welcome questions and am just sort of in the process of learning. Heather and I are working hard to apply this, and so we'll talk about sort of where we are. I'm going to go over some background on process tracing as an innovative qualitative method to use in public health evaluations, and then give you two examples, one from Uganda and one from Madagascar, and then talk about some conclusions. So process tracing, as I said, is a qualitative method. It is a case-based approach, so it's using one idea, one case, to look at a linear causal chain that has specific steps that derive from a conceptual model or a theory of change. And this is a definition that you can find online. I've tried to put in references, and there is a slide at the end with references as well. The qualitative method is used to answer whether, why, and how an intervention causes a health outcome. So it really tries to unpack the steps sort of involved with getting from an intervention to a health outcome. It isn't a method that's been used in public health evaluations commonly. I think that's why people are very interested in it as an innovative method. It derives from, if you look in the literature, as we did at the beginning, we really have spent a lot of time reading and learning about the history and method of process tracing. The examples came more from the political science and other social science realm. We did find some people who are using process tracing in public health and contacted them and had phone calls with them to talk about their experience as well. So I do have some acknowledgments at the end of this presentation to really thank those experts that we talked to and gain some insight. You'll see some of the language that's included in process tracing because it does come from these other social sciences, and it also, some of the examples, if you look up process tracing, come from, sort of the examples are from murder mysteries, which is kind of interesting. They even use sort of Sherlock Holmes cases to talk about how to solve a murder. So that's just something to keep in mind as we get to some of the terminology that's used in process tracing. So I wanted to make that clear. We did not define these particular tests that are used in the method. So on the slide here, you see the process tracing method, and I'm going to walk through each of these steps, but these are not unusual ones to the world of public health and evaluations. The first is to develop a theory. The second is to develop testable hypotheses. The third is to identify the evidence that's going to test those hypotheses. Step 4 is to collect data, and 5 is to analyze the data and apply the test. So it's not a method that seems foreign to many of us who already do evaluations on public health. And it's important just to keep in mind that it's a method for assessing causal inference within a single case design. And you need to think ahead also to the fact that process tracing is also looking at generalizability, and I'll talk a little bit more about that. So the first step is to develop a theory or a causal mechanism. This involves elaborating the steps between the intervention and the outcome. And as I said, it's sort of like opening that sort of black box that's often between those two areas. So this is just a visualization of what a sort of generalized conceptual model or a theory of change might look like. It gives detail about how the intervention is where you start on the left side, and then specifically for process tracing, you really have to define each of the small sort of steps or strategies that would be in between the intervention and the outcome. And those sort of gray arrows are important to keep in mind because as I said, process tracing is about a linear causal chain. So it really has to be that as you work on your model to test using process tracing, that you have distinct strategies that are linear. So that strategy 1 would lead into strategy 2, 2 to 3, 3 to 4, and so on. And you can have multiple strategies or steps along the way. You'll see in some of my examples we have 5 or 6 steps, but they really, as you think about and lay out what you're planning to test, they need to be linear ones that wouldn't be that 1 would also affect 3. You really need to think about how each step is related to the next one. So you need to think about causality, how each step, again, would follow into the next step. Only include the necessary steps, so nothing extra. Make sure that the steps or the strategies are measurable. And then, as I mentioned, think ahead to generalizability so that you also would really spend time honing your language that you're using to define those steps or strategies so that your language could be applicable to other situations or contexts. And I'm going to talk specifically about these two examples, one in Uganda and one in Madagascar. And it's important to keep in mind that this takes time. Defining your causal mechanism is really important, and the structure of it and the causality and thinking ahead and the language you use and such are really, really important. And you'll see that we use two different strategies as we were setting up these two evaluations in Uganda and Madagascar. The Uganda one is very sort of small and specific, and the Madagascar example is much more sort of larger on a bigger scale at a macro level. And you'll see those two examples. I just want to, again, stress this importance of this concept of generalizability, which is another reason we were interested at Measure Evaluation in using and trying out process tracing, partly to the novelty of using qualitative methods to look at causality is very appealing, and this concept of generalizability, because you are testing this sort of theorized causal mechanism, and you're looking at within case analysis that's supposed to be able to be more broadly generalizable and applied to other contexts. And again, I've tried to include these references throughout the presentation. Okay, so moving on to the second step in the process tracing method, which is developing testable hypotheses. For each step in that causal mechanism, each strategy or step, you write, once you get all the language sort of figured out and your causal mechanism set, then you move on and you write a hypothesis or multiple hypotheses for each of the steps. You write a core hypothesis, you write an alternative hypothesis, which essentially is just the opposite of the core. And then you think of any hypotheses, we call them bonus hypotheses, ones that would be another reason why you could look at the evidence and say there's this other reason or other sort of evidence that would prove a different hypothesis correct. So those are the bonus hypotheses that you think about. And as you're writing these hypotheses, you need to think about these questions. What would you expect to observe if the hypothesis is true? So you might put into that something about like improvement that you expect to see, or no change, or possibly a worsening of the situation. And that you also need to look at questions like which observations would be very unlikely unless the hypothesis is true, and which observations would practically prove that your hypothesis either was true or not true under other circumstances. So keeping in mind that idea of generalizability as well. All right, so now we get to the sort of terminology I mentioned that's unusual in process tracing. There are these 4 very specific tests that are part of the method. And I'm going to walk through each of these tests so that you understand sort of how this works. The 4 tests are, the first is straw in the wind, which is evidence that you would have to prove this test right. It would be something that, evidence that you'd like to see. A hoop test is what you expect to see. A smoking gun test is what you'd love to see. And then a doubly decisive test is if you have unrefutable evidence that would prove your hypothesis either right or wrong, or you'd prove the alternative hypothesis. So again, these terminology are I think mostly derived from the fact that the examples that they use in process tracing are related to solving a murder mystery, which is the sort of smoking gun one, I think comes from that. These are not my favorite names for these tests. I really think of these as the like to see, expect to see, love to see terms, but I think it's important if we're applying a method that is already established in another social science field that we, sort of keep to using the names of the tests. And I'm going to walk through each of these so this becomes a little bit more clear. So straw in the wind is evidence that would be something that you'd like to see. This is sort of the weakest kind of test. The evidence would be weak for this test. It wouldn't be, you wouldn't find evidence in your case that you're testing that was either necessary or sufficient to prove your hypothesis. it would have low specificity and low sensitivity. And I'll show you a visual of these tests on a graph that looks at specificity and sensitivity. However, you would have evidence, at least some, that would help you move sort of incrementally toward greater confidence that you could accept your hypothesis or reject a hypothesis. So you'd have to have sort of some evidence that would prove this test right. But again, it is sort of the weakest test. The second test is the hoop test. And again, I think of this as what you'd expect to see if the hypothesis were true. This is evidence that would keep your hypothesis under consideration. And just to apply it again, the specificity and sensitivity are important to think about, just to try to relate this a little bit more to maybe the quantitative world. For the hoop test, you would have low specificity and high sensitivity. And if you don't see any evidence, the hypothesis could be disregarded. That core hypothesis could be disregarded. So it could be evidence for your alternative hypothesis. So this is sort of the next level of evidence in these tests. So the smoking gun test is defined as what evidence you would have that we would love to see. And this would prove your hypothesis correct, that you would have high specificity, low sensitivity, and if you didn't see, if you did see evidence that is loved to see, you would have proven the core hypothesis correct beyond a reasonable doubt. So smoking gun, sort of, you have enough evidence here to say this person, that the idea here is, again, the murder mystery kind of world, that you would know that this person, committed the murder, that kind of thing. So you'd have enough evidence to say, yes, I accept my hypothesis beyond a reasonable doubt. And then the doubly decisive test, which doesn't have sort of a shorthand kind of like to see, expect to see, love to see, is just very rare. You would have sort of overwhelming evidence that would confirm your hypothesis and support causality. This would have a high specificity and high sensitivity, and I think is a really pretty rare to say that you absolutely know that one step in your causal mechanism caused the next step in your causal mechanism. That's the final and fourth test. So these four tests can be sort of mapped onto this graph here, just to put it sort of look at how the tests are sort of connected and how they relate to each other and how they relate to specificity and sensitivity. So hopefully I really keep this visual on my desk as I'm doing analysis, because it really helps me remember sort of which test and the definitions of each and how they relate to each other, and what kind of strength of evidence you need to prove one of these tests correct. And I think it's important here to think about these tests as reflecting the probability. So again, sort of relating to the quantitative world, thinking about probability of observing a particular piece of evidence if the hypothesis under consideration is true. It is important to think of these tests as a probability test. And for us, we collected data in focus groups because we really felt, I particularly felt strongly that if it was possible to gather a group and to get a focus group together to walk through guides that we developed specifically for these process tracing evaluations, that it was important to get sort of a group conversation about these probabilities, about sort of the possibility of evidence for either supporting or rejecting the core hypothesis. And you really, as you're doing the analysis here, the second bullet point on the slide, that you weigh the evidence according to how much evidence increases that probability that the hypothesis is true, or how not finding the evidence increases the probability that the hypothesis is false. So you really, at least as I'm working through analysis, I think about probabilities and sort of the weight of the evidence. And then as we move along in the process tracing method, we get to step 4 and 5, the collecting of the data and the analysis and applying the tests. As I mentioned, we use focus group discussion data to sort of get a better sense of how the causality and the generalizability of this case that we're trying to apply, and then analyzing the data is that 5th step. And we found that it's taken a tremendous amount of time to do analysis, more maybe because this is new to us, but just sort of thinking ahead, at least for me, the beginning steps and the end steps in this process are sort of the most time consuming, which I think is quite sort of common for qualitative projects and evaluations as well. So with the analysis, again, think about the fact that your unit of the analysis is a case, and it's what your outcome is, your effect under investigation, your hypothesized cause, so all those the intervention at the beginning, and then those links between the cause and the effect. So again, just wanted to make sure to bring in the literature and the references that we really relied on in order to look at how this process tracing method works. And the goal, just to keep in mind, is to estimate a level of confidence that a particular intervention has caused or contributed to a particular outcome in a particular stepwise linear fashion as it's laid out in the causal mechanism. So I don't think process tracing is for, we should use it for every qualitative study that we're doing. I think it's important to think about where it's applicable and not, because you really do need to have that causal mechanism laid out in a very linear way. And then think about if you're trying to look at causality between an intervention and a health outcome or an outcome. Okay, so I'm going to give you 2 examples. The first is from Uganda, and this one is process tracing of a project that we evaluated called the Partnership for HIV-Free Survival. The process tracing method was devised for Uganda. However, just to give you a little bit of background on PHFS, the Partnership for HIV-Free Survival, that's PHFS. It was a project that was designed to prevent and eliminate mother-to-child transmission of HIV, so PMTCT or EMTCT, depending on the country, which sort of term they used. And it brought together proven practices from all the work that we have done on PMTCT, as well as employing quality improvement methods. There's a nutrition component and a community outreach component to improve health outcomes of HIV-positive moms and their HIV-exposed infants. And it was supported by USAID and PEPFAR, and it was implemented between 2012 and 2016 in 6 countries. There you can see Kenya, Lesotho, Mozambique, South Africa, Tanzania, and Uganda. And so the process tracing component that I'm going to talk about is specifically for Uganda, because that's where we did, as measure evaluation, a more in-depth look at PHFS. However, we did, and I again included links in the slides and references to other work that we've done for PHFS. We visited all 6 of the PHFS countries, and we did it, we call it a legacy evaluation because we did our evaluation in 2017 and 2018 and looked back at the program that was had ended previously. And it's important just to know the context of this, and if you're interested in work in PMTCT or have colleagues you could pass this along to, that evaluation report is available on the Measure website. There are also country-specific briefs. And then we did a more in-depth look at PHFS in Uganda and did an outcome evaluation there. We have manuscripts under review from the outcome evaluation, so I don't have a link to share with that yet, but we'll make sure to share once we have those manuscripts published. And then our team created, the last item on this slide is the name of a guide that we created that took our sort of lessons learned and put it all together into a sort of a practical guide that looked at how and why you could implement the PHFS approach to PMTCT and EMTCT programs. And that is about to be published by the end of October. And so we'll make sure again that that link to that document is available to everyone. So our measure evaluation team took all the information from these evaluations we did of PHFS and decided we were missing the voices of women currently in PMTCT or EMTCT in Uganda, and decided that we would also design a small qualitative process tracing study in Uganda to look at these causal mechanisms that we created for Uganda. Unfortunately, we couldn't complete the data collection because of IRB review delays, but we created a guide and a sample protocol that can be used as a resource. And you see the link there on the screen and a visual of that image. What we did through the legacy evaluation of PHFS is we created this retrospective theory of change. And I know you don't need to try to sort of absorb all of this, these boxes and information on the screen, but the idea here is just to know that we identified these different areas that were really important for creating a PMTCT or EMTCT program that was successful across these 6 countries. For process tracing, we decided to look at specific sections of this larger theory of change, and we even looked very closely at one small component of our the sort of larger theory of change. And we created this causal mechanism. This is one example. This one is focused on mother-baby pair clinic days. And how those mother-baby pair clinic days, which was our intervention here that we were going to test in process tracing, how those clinic days related to increasing retention of mother-baby pairs. And so we set out this causal mechanism, this pathway with these steps that were in our sort of understanding and the background research that we had already done, that step 1 here, that the health facilities scheduled those clinic days we wanted to test to see if that step 1 was causing step 2, the fact that they were scheduled on a clinic day, that then related to the fact that the pairs actually came on the clinic day, and that step 2 would relate to step 3, which is that mothers felt less stigmatized, which would relate to step 4, that women would feel more satisfied with their experiences, that would relate to step 5, that mothers returned for their appointments, which led to the outcome of increased retention and care. So we really spent a lot of time working on the language, changing the steps, making sure that it was as linear and as laid out as possible. So this is step 1, right, in the process tracing methodology, is to lay out this causal mechanism and think about the linear aspect of it. And then the step 2 was to create hypotheses. So for step 1, and you do these hypotheses for each step, and I'm not going to walk you through every detail, but I want to at least give you an example, that here we created sort of these large, for us they were big tables, but you can do it in other ways, but that you would designate sort of where your data source, where your information was coming from. For us, we focused on focus groups, and that you would write a core hypothesis and an alternative hypothesis that would relate to that particular step. So you can see that on the slide for step 1. Here's another example for step 2. We had multiple data sources for our step 2 as we defined it, some of which I just wanted to point out here was quantitative data sources, because in Uganda, we're also doing an outcome evaluation, as I mentioned, so that we did have quantitative data from the clinic records about retention. So we really had quantitative data that could help relate to not only step 2, whether pairs came on that designated clinic day, but also related to our outcome of improved retention and care. And here we had 2 different sources of focus group data, health facility staff and from moms. And we wrote our core hypothesis, we wrote our alternative hypothesis, and then, as I mentioned, you can also write these bonus hypotheses which would say maybe there was another reason why step 2 was happening, that women were bringing their babies on these clinic days. Maybe there was a separate reason that coincided with those clinic days, that there were either nutrition demonstrations or that food supplementation was given out, food assistance, something like that. So again, I'm not going to walk through each of the steps for all of our hypotheses and such, but I just want to give you at least a taste of how that method would work. And again, this takes a tremendous amount of time to set out your linear pathway that you're testing and then write all of these hypotheses and think through and refine them as you go. So I just wanted to say that we also did another, set out to do another look at another piece of this retrospective theory of change. We looked at some components of the QI part of PHFS, and we set out another causal mechanism that we wanted to look at. This was, as I mentioned, focused on quality improvement, specifically on the supervision and coaching, and how the supervision and coaching contributed to improved and sustained QI work. And I'm just, for the interest of time, I'm going to sort of keep moving forward, but you'll have these slides and can look back at sort of the details of this example as well. But here, so I moved on to, this is for step 3 in the QI causal mechanism. Here I wanted to point out that our data sources included multiple focus groups and the QI journals that were kept in the facilities for PHFS, and that we were going to look at those journals to look at the frequency of the QI team meetings, how people were notating their change ideas, which is part of QI, and how they tracked indicators, and just sort of the general sort of completeness of the QI journals themselves. And again, we wrote core hypotheses and alternative hypotheses, and here we have multiple bonus hypotheses that related to this step 3 in our causal mechanism. And we are gonna, I see a lot of people still asking about sharing slides. So we are gonna share the slides. I know I'm moving quickly through this example, but you'll be able to look at these examples in more detail on the slides after the webinar itself. I just don't want to take too much time. I know people probably work in different areas, so I didn't want to spend a lot of time talking about either QI or PMTCT, just because that's sort of related to work that I do and that our team at Measure Evaluation had done. Okay, so moving on. So unfortunately for us, IRB delays caused the fact that we couldn't collect data to do all of the work that we planned to do in Uganda. We did write that guide and sample protocol that's in the slides. The link is there. It's up on the Measure Evaluation website. So you can look at that and see it as an example of work that we prepared for and trained data collectors to do for process tracing related to PHFS. So my second example here, this evaluation 2, is a prospective study of health information system strengthening, so HIS strengthening in Madagascar. And I know we have some colleagues from our team in Madagascar on the line. Thanks for joining. So I'm going to give a little bit of background about this project in Madagascar. And for this one, we did collect data, and I am not going to spend a lot of time showing all the data, partly because we haven't presented it in Madagascar yet, and we're still in the process of doing the analysis. But I think it serves as a good example of process tracing and how it can be used in a more, again, macro level. You'll see this causal mechanism is not as sort of specific as the examples in Uganda. This is for Madagascar much more at a sort of higher level. So just to give you a little bit of context, the Ministry of Health in Madagascar and the US government made a commitment to reduce reporting redundancies that were happening in the country and to eliminate vertical subsystems, so essentially to integrate the health management information system in the country. At the same time, a malaria-specific surveillance system existed to require active detection of malaria cases. And so there was a real push, and it's still a big push. A lot of work has been done over the years to do integration of these health information systems in Madagascar. And measure evaluation has been around a very long time, but our current phase that we're ending began working on this particular mandate of integration of the health information system in February of 2017, and there was an acceptance of what they call the roadmap for the Subcommittee on Health Information Systems. And this roadmap has 9 specific strategies that are included in it. And I have those on the slide, but again, I'm not going to walk through all the details of this in particular. This evaluation in Madagascar was part of the Measure Evaluation Learning Agenda. And just to give you sort of a brief understanding of the learning agenda, we had key questions that were about investments in health information systems. We looked to identify sort of evidence-based packages of health information system interventions, and the funding for this particular study in Madagascar was from the Learning Agenda budget, because we were looking to build evidence on what works for strengthening HIS. And we had these 3 overarching questions for the Learning Agenda, and we did a number of studies in multiple countries to look at strengthening HIS. And so this work in Madagascar was contributing to the Learning Agenda. So for our study in Madagascar, we had 2 objectives. One was to document the system strengthening process, resulting interventions, and to look at efforts to monitor and assess their implementation. And then the second one was to use process tracing to understand and verify the process by which changes in key HIS interventions resulted in changes in HIS performance, looking specifically at data quality and data use and service delivery. So the Measure Evaluation Learning Agenda created this model, as we call it the Health Information System Strengthening Model, or the HISM. And this was a model that we created that was used across all of the work that we did on HIS strengthening for all the countries we worked in. And each country mapped their activities that they were doing for HIS strengthening onto this particular model. And so this model, like in the last example where we started with the retrospective theory of change, for this example in Madagascar, this is the sort of overarching kind of conceptual model that we used in order to sort of get down to what we were looking at in more specificity for process tracing. So again, starting with just sort of how things are linked together in sort of a visual way is really helpful for getting us started in process tracing. And this is, again, I put these slides in here partly just to get more context and leave them with all of you as a reference, that the roadmap that was laid out in Madagascar as part of that first big meeting in February of 2017 laid out these 9 strategies that have been the focus of all the work that we've done in Madagascar with all the different sort of partners and players throughout the government in Madagascar on this roadmap to strengthen and integrate the health information system there. And so for our study itself, we did data collection that was related to those study objectives. And the bottom one on this slide is that qualitative data collection for process tracing to describe the causal chain between the intervention activities and the relationships of the HIS performance outcomes. So here is the causal mechanism that we were testing using process tracing in Madagascar. And you can see that it is as I mentioned, on more of a macro level. So it looks at the intervention itself was the implementation of the roadmap, those 9 strategies, and it established different subcommittees for HIS strengthening. And you can see here, I'll just walk through these so you understand, because this I'll present a little bit of the results that we have, that each of the steps here are, again, at a higher level. So the first was to design and implement procedures and mechanisms for strengthening HIS. that would then lead to step 2, that there would be the development of, updating and launching of tools and guides and training plans and supervision plans and DQA, data quality assessment systems. That then that second step would lead to the third step, the development and implementation of plans to enhance the competence of officers who did all of that work related to HIS strengthening. That then would lead to step 4, increasing the engagement of officers in data demand and use. That then would lead to step 5, implementation of strategies to create a culture for data use for decision making. Finally, to step 6, crafting and shaping the use of communication platforms, various ones that were laid out in the roadmap, that then would lead to the outcome of an efficient, unique, and integrated health information system. And for us, we did different data collection sort of periods because we had those different study objectives and the different sort of data collection mechanisms. So that we did, in this case, collect data multiple times, again through focus groups. And in those different data collection periods, we also talked in general about how the roadmap was being implemented, so that we had a real sense of the context of what was happening in terms of this work in Madagascar. And then we also did data collection and piloted our data collection instrument for how to ask questions about this particular process tracing mechanism that we were testing. And so we currently have data from 7 focus groups with 43 participants from directors and technical staff from all the different partners who were working on the implementation of the roadmap. So again, for each of the steps, we defined where the data source, the core hypothesis, any alternative hypotheses, and bonus hypotheses. And so same steps. And then just to give you a taste of sort of the way the analysis worked was that for each of the steps, so we're still in step 1, and I'll just take us back quickly to step 1. So it's to design and implement procedures and mechanisms for institutional strengthening of HIS. So this was also about looking at how the intervention affected step 1. So here we have evidence to support the core hypothesis and grouped that from these multiple focus groups. That here you have some quotes about the workshop was really necessary. There were no standards or procedures. It's as if everything was done blindly. This is a comment that relates to before the roadmap was implemented. Here we go. The purpose of the Nsira Bay workshop, which was that workshop that was in February 2017, was to develop an operational plan to improve HIS systems. Somebody also commented that there were other workshops before the one in Nsira Bay, but that committees were established and everything was institutionalized. So this is looking at whether or not that meeting, which was the intervention where the roadmap was sort of finalized and accepted, and these committees were created, if that related to how the sort of the work moved forward. There was some evidence here against the hypothesis that there were not a lot of efforts made, that there were, a lot of efforts made before the roadmap, and that maybe the roadmap itself, that there are some departments that don't yet know about these standards and procedures. So looking at and weighing, as I mentioned before in the method, that you weigh the evidence, and we do this for sort of qualitative analysis in general anyway, but that you really are thinking about those steps and that causal mechanism and your hypotheses, that you're trying to find the evidence in your data to either support or reject the core hypothesis, or maybe to support one of the bonus hypotheses. You weigh that evidence, you look back at the hypothesis, you remind yourself of what the tests are and the definitions of those tests. Remember, the straw in the wind is the like to see, and that the evidence would be very weak. Or the hoop test, the second one, what you'd expect to see, that it keeps that hypothesis under consideration. Or the smoking gun test, which is that next level data that you'd love to see that would be sufficient to prove the hypothesis. And for this one, and again, I'm not going to go into all of the data itself, but for this, our conclusion was that for step 1, that we had enough evidence to support the smoking gun test in process tracing, that we could prove our hypothesis correct. So here, that the stakeholder workshop, which is that one in Sierra Bay in February of 2017, that workshop where they implemented the HIS subcommittee, that galvanized efforts to put in place procedures and mechanisms for institutional strengthening of HIS. And that institutional piece of it was really an important one. So even though there were, as some of the evidence maybe against on my previous slide was that there are many that there were a lot of efforts made before the roadmap, there was sufficient evidence for us to say, yes, we accept this core hypothesis. There's sufficient evidence to support that smoking gun test, that workshop was so critical, that they had the right people there, that they really institutionalized the efforts to strengthen the health information system. So that is, I'm just going to stop there with all the examples and then conclude, because I know there have been a lot of questions and I want to get to those. So just in our experience, we really have found that process tracing has been really valuable, that it really lets us look in depth at how and why an intervention influenced an outcome, that it really does look at causality. It can add a lot of clarity, but I think I've mentioned a couple times how much sort of work it is, partly because we're new at this, but also I think that their process tracing does need this real attention to, like, what am I measuring? What evidence do I need? What are all these tests? But that it really can improve the precision of your data collection tools, because you can add process tracing onto an existing study itself, but it makes it overall that there is this systematic, transparent way to analyze qualitative data and identify and rule out alternative explanations, to justify your conclusions and show where your data are weakest. There are some challenges also to note, that it's really detailed and analytic. So it might sort of be more sort of appealing to people who like to get into that sort of detailed and language and how do things relate to each other. You need to really think about your theory and what you're testing and make sure that it is testable. I had a previous slide on looking at making sure that you have data that is measurable and such. You don't want to go too micro, too small, because it makes it difficult to test your hypotheses. And then I think you also need to be really careful about the absence of evidence. So if there's something not being said in an interview, that absence of evidence, if that's evidence that your hypothesis is not true, you need to sort of say, you know, what is makes sense and doesn't make sense in terms of what you have as evidence and what's maybe missing as evidence. And it really is an iterative process. You're testing hypotheses, ruling some out, identifying evidence gaps, because you may just not have enough evidence. You might need to create new hypotheses and go back and collect more evidence. We didn't have the opportunity to do that as much, partly because the Madagascar work was prospective and ongoing, and we were sort of trying to grab data and information as the work was being implemented. So that was somewhat challenging, whereas I really had hoped to do the process tracing study in Uganda because it was so retrospective and might have been a sort of easier place to apply the process tracing method. Any case, I do want to thank our funders, USAID and PEPFAR, and our colleagues at Measure Evaluation. This use of process tracing really sort of stemmed from Heidi Reynolds, who was the director of evaluation at Measure Evaluation, to inspire us to use process tracing not only in Madagascar, but then to encourage us to think broader and apply it in Uganda as well. And then I don't know if my colleagues in Uganda are on the line, but we did so much work to set up the study in Uganda, and we're all sort of sad it didn't happen. And then our colleagues in Madagascar, I saw Fenor was on, and those who were on the Research and Evaluation Technical Working Group, who we will be presenting all of the results from the Madagascar study to in the subsequent weeks. And then the experts that we reached out to, who are really helpful. Melanie, I think she's on, not sure, really helped with sort of thinking about the process for process tracing, and some of the slides and visuals are hers. So I definitely give her a lot of credit for helping us and guiding us in this work. And here is a slide with some of those references. There are lots more, but these are the ones that really stood out to us in terms of being the most helpful. And that's it. So hopefully I've left 9 minutes for questions. So Heather, I'm going to hand it over to you to try to help guide which questions to respond to.
Yes, so we have currently 41 questions. I just see one right here at the end that says, is this only prospective or can it be retrospective? It absolutely can be retrospective. I'm going to maybe go back to the top, and maybe if we can keep answers really short, and then also maybe if we have a little extra time, we can try to get as many answers as possible. So okay. How is this different from systems thinking?
I'm not sure I'm qualified to answer that. I know, Jessica, do you have a sense of that? I think it's related, but I think my short answer is I think it's related, but I think it's more about a very small causal mechanism, or it's not small, a very focused causal mechanism that you're looking at testing causality linearly in one case that then you would generalize to other cases.
Okay, and how does this method differentiate between or interlink causality and attribution?
I don't think it really does. Maybe that's something to look at more in the literature, but my short answer is I don't think it really, I think the level of evidence that you have and the tests that are being applied might have a bearing on if you can say, yes, smoking gun, that's a stronger, you have more evidence to support a smoking gun test than, let's say, a straw in the wind test, that maybe you could talk about attribution for things that are straw in the wind, but causality is more smoking gun or doubly decisive.
I'm also going to suggest that you leave the slide on maybe the resource page
okay.
while we're answering questions, so people can maybe take some of that down if they want to.
Okay.
Okay, so how does one decide what is a necessary step, what to include or exclude, seeing that this is a qualitative analysis methodology?
Something that I should have put in the slides but didn't, and I'll say it here as sort of strongly as possible, you need to have the right evaluation team with all the right people who know the context, who are the qualitative evaluation experts and such, because I can't tell you how many drafts we went through as a team, sort of trying to hone and refine each of the steps, and you really as a team need to think about what to include or exclude, and hopefully get it right. Yeah. Or, try it out and then try out your guides and see if people are sort of agreeing with you or not, and pilot test them and hone them even more. So it is hard to know what to include or exclude. It's just sort of you need the right team and the right people in the room.
I have a specific one about the tests, and I'm not sure that this is true, but the question was, why is necessity prioritized over sufficiency, i.e. hoop test is greater than the smoking gun?
It has to do with that visual I showed, and I really do have that one printed out and is on my desk with the 4 tests. I'll just go up to it now. The 4 tests in that matrix kind of thing, because it is about probabilities, right? So there is something called contribution testing, which is related to process. There it is. That is related to process tracing. It's sort of people who weren't as comfortable with sort of weighing the evidence really wanted to take that evidence and try to apply sort of numbers to the probabilities. That's contribution testing, which we decided not to use. We really wanted to stay in the purely qualitative realm. But this visual really helps me think about the weight of the evidence and where, sort of in terms of specificity and sensitivity, how the tests are related. That's my quick answer on like hoop test is greater than, or the way I think about it is actually smoking gun is weightier, that you have more evidence than a hoop test.
Okay.
I think of it as straw in the wind is your weakest test. Hoop test is your next level. Smoking gun is the next level, and then doubly decisive is rare, and you really have to have a tremendous amount of evidence to say doubly decisive.
Okay. How has this method been used in mixed method studies or evaluations, or how would you use it with quantitative methods?
Well, the plan in Uganda was to have this process tracing evaluation be sort of a supplement to outcome evaluation that we completed in Uganda. And the outcome evaluation was mixed methods. It had a retrospective chart review to gather quantitative data over all the years that before the program PHFS was implemented, during the demonstration scale-up phases, and then after the program was sort of officially ended in Uganda. So there was quantitative component, and then we did qualitative component looking at a lot of the QI implementation, that quality improvement implementation. So we were missing the voices of the moms, and we thought that this was actually a perfect chance to look at causality in terms of some of those really focused parts of our retrospective theory of change. So it definitely is something that can be used in a mixed method study. And it would have been great to have that in Uganda.
What kind of methods are the best to gather evidence for testing? I'm going to really just try to go through as many of these as we can.
Okay. Again, I think focus groups, but that's what we've done. So I think it would be fine to gather evidence through observations or in-depth interviews as well. I think that any of our sort of usual qualitative data collection methods would be good to gather evidence for process tracing.
Okay, and can findings be generalized to a wider area?
That's the idea. Yeah, the idea is that then you could say, for Madagascar's health information system, experience and our evidence that we have through our process tracing evaluation, that then you could apply those results to other countries that were also looking at strengthening their health information systems.
And the causal mechanism was based on intuition, or is it based on lit review?
Lit review, and again, having the right people on your team who are making sure that you're understanding the context and including the right steps in your mechanism that you're testing, and that you have them in the right order, and you haven't included anything that shouldn't be there, and you need sort of not just intuition. I think it's more that you have the right input from the right people.
And we also did conduct focus group interviews to gather information because we were coming from an outside perspective. I think somebody who had more knowledge of the situation might be in a different position, but we did use that first data collection opportunity to really understand the context and put that together.
Yeah.
There's a specific question on the causal mechanism. I think it was from the first PMTCT one, and it says, is it okay to have 2 items in one step, i.e. step 3 had an and in there?
Yeah. So I know we sort of toyed with the back and forth of should that and be there, and we felt like when we piloted the data collection tools and really talked to people involved with PHFS in Uganda, that and was okay to have there. Yeah.
Okay, so this is an interesting one. I understand that the process has to be linear for the process tracing to be applied. Can the process be, however, branched yet maintain linearity for this process to be applied?
So then I think the branching, it's a really good, because we definitely, we started with, for PHFS, that huge multi-arrowed, like huge causal or huge retrospective theory of change. And so it was hard to like think about, well, aren't there all these branches? But I think for process tracing in particular that you need to have a causal mechanism that's as linear as possible. That's what the process is designed to do. So if you're going to have a branched mechanism, I would make it 2 different linear mechanisms and test those 2 linear mechanisms separately. That's my fast answer.
Excuse me. I think this also gets to sort of how the implementation would go. Were they able to quantify difference in levels of satisfaction related to less stigmatized versus convenience of having possibly 2 visit journeys combined into 1? And I think that, we weren't able to implement that project.
Yeah.
But it's not necessarily about quantifying levels of satisfaction. It's about whether those elements led to the increased satisfaction, which ultimately culminated in that end result that we wanted to see, which was increased retention.
Yeah, I think that's a great answer.
So do you think this approach always needs a research team? We have a similar approach, matter of focus, but we are trying to make it simple enough for embedded evaluation.
I think, again, you need a multifaceted team of people working on this. You need people who know the context of what you're evaluating. I do think you need a research evaluator type person with that background, just because it is qualitative evaluation methods, and doing that right is, good to have somebody who has experience doing that work.
Okay,
I'm just going to process tracing expert. It just needs to be somebody who's got sort of the background in research and evaluation, I would say, and qualitative.
We have still a lot of amazing questions, and it's 10:01 according to my clock. So I just wanted to point that out and find out, what we'd like to do about that.
If you need to run over a couple more minutes, that's fine. We've got the room reserved a little bit longer.
Okay. This is a paragraph of a question. For holistic programming, theories of change are often quite complex with multiple overlapping causal pathways hypothesized. How do you recommend handling this with a process tracing approach, given that linear pathways seems to be a requirement? The simpler, the better. Also, we zoomed in on a specific component in Uganda. Did this work well?
Yeah. Okay. So I've scanned it. So it's about how do you focus in, and did that work for particularly the data collection too? You have to hone in. If you want to just do, even Heather mentioned, if you want to do qualitative data collection and learn about sort of the context or how all these different components, like on our theory of change for PHFS, that huge, all of that information was gathered through qualitative methods in 6 countries. And so we talked to everybody we could about PHFS at the community and facility and district and national and we talked to everybody who could about PHFS in all 6 countries and put together that theory of change. So that's, qualitative methods are great for that kind of thing. For process tracing, you have to hone in. You have to find a linear mechanism that you're testing, and you're testing causality. So you really have to think about whether or not process tracing is what the method that you should be using or not. And you have to hone in, and you have to then design your qualitative data collection guide to be able to gather the evidence that you need in order to support or reject your hypotheses.
I have a couple other questions down here near the end that I wanted to focus on. One is from Fanor, who's in Madagascar. What is the best period to start a study using process tracing at the same time as the intervention versus at the end of the intervention or during the intervention, and how much time is needed to measure the causality of an intervention?
I think those are great questions. I mean, I think for Madagascar, they're definitely, I'm so glad that we collected data during throughout the work that was done. But I think having enough time pass has really been important. The other issue I think for Madagascar, and would be applicable to other situations as well, is just to make sure not only that you have the right people who are in the room in terms of defining your mechanism that you're testing and all of that, it's also having the right people who are in your focus group or the right people that you're interviewing for key informant interviews or whatever it is. You need to get the right people. We did a data collection in Madagascar sort of to pilot our data collection forms, and we didn't have the right people. And so those were not, that taught us that we needed to make a bigger sort of effort to get the right people in the room. So it's a matter of timing and a matter of getting the right people to answer the questions.
And another question from within our group at UNC from Sean Curtis: systems models for complex systems are often not linear, but this approach seems to be the most useful for linear causal models. I wonder whether this model will work as well for complex systems.
Yeah, so I mean, Sean, I think that the model would work for complex systems as long as you, again, honed in and focused on a very specific causal mechanism. Even though our one in Madagascar was more at the macro level, it again was focused on one linear pathway. And so I think that you can definitely look at complex systems, but you need to say, I'm going to look at this piece of this complex system that I think is linear, and then I'm going to look at another piece, let's say, of a complex system that I also really believe is linear, and then look at causality within each of those maybe different pieces of a larger system. That's sort of what we were trying to do with the PHFS example in Uganda, was to look at that huge retrospective theory of change and focus in on one component of service delivery and one component of QI.
Okay, we still have a lot of open questions. We can keep going.
Do you want to just go to 10 after?
Yeah.
Okay.
So this is, I think, might be interesting. If you had not been able to prove step 1, would you then have to cut off the study as it's built in a linear model? Or relatedly, how do you weight qualitative evidence, such as the example of the competing quotes in the Madagascar case? There were several questions about how you weigh the evidence.
Yeah, it in some ways it's really subjective, and you need to sort of, again, work with your team and say, what do you think? And what do you think? And come to a consensus among the team who's doing the analysis on what test you feel like you have evidence, sufficient evidence to support the test. Because it is still qualitative data. It's not, it's not numbers. It's words and quotes and such. So, and in terms of if step 1 is not, supported, you can still look at 2 to 3 and 3 to 4 and 4 to 5. And it wouldn't be that you would not have a conclusion. You wouldn't cut it off, but you'd say, this is a straw in the wind, or there's just insufficient evidence to even support a straw in the wind. Or I'm accepting the alternate hypothesis. We thought that this one thing related to the next thing, but actually it was the opposite. So you would still state what you found, and you still could look at causality later on in your causal pathway.
Okay. Let's see. Can process tracing be used for new pilot projects or programs with uncertain causes of change?
I think I would recommend using process tracing, maybe not on something that's totally new. I think I would do it. I mean, Measure Evaluation has been working on health information system strengthening for a long time. That other visual that I showed with all the gears and such, that is our health information system strengthening model, took years to develop. Yeah, I think probably I wouldn't recommend using process tracing on something that was super new, where you don't have any background or information to even set up what you think is a causal process that you're trying to test. So I'd say do it on something that you feel like you have more sort of is more established and you really want to understand causality.
I'm skimming some of the additional questions because we still have quite a few open. When examining each step in the chain, do you look at it as an effect that needs explaining or as a cause that needs understanding, or both? Looking backward and or forward?
Those are great questions. I think both, actually. Yeah. That's my very short answer. That's a great question. I think, it matters sort of to look forward and backward, and it matters to look at causality and effects as well. Yeah.
I think this one gets at how we develop the causal mechanism again. And so it's talking about the Madagascar example. It says, it seems that the 9 strategies are the objective set which define the activities to conduct in the work plan. So doesn't it mean that the steps will depend on the objectives developed in the work plan? The steps in the causal mechanism, that is.
Yeah, yes, I definitely agree. Yeah, I think you have to look at, I mean, that is Madagascar. That is, we looked at what was the plan, what were the strategies. We even mapped out each of the steps in the causal mechanism was related to one of the strategies from the roadmap. And we actually thought about doing that macro level causal mechanism that I showed as the example, and then diving into like one of those steps on data use, and like making another causal mechanism that was much more focused just on data use, and testing another causal pathway there. But we decided not to. We just stuck at the high level because it was related to the work plan. Yeah, good, very good point.
I would also add that we looked at we looked at those strategies to see if they looked to be causal, because I think the intention when you make a work plan, obviously, is that your interventions will lead to your intended outcome. But the linearity wasn't there, and there were also other factors going on that we wanted to incorporate. And so it wasn't like we could just transition those activities or strategies as they were already outlined directly into a causal mechanism. It was a little more complex than that. So we're now at 10:12, and our official IT moderator is going to have to move on. But we will get a list of all the questions, and we can email people later with some more answers. So I really appreciate everybody sticking with this. You had really amazing questions, and there are still some that are not answered, but we'll try to get to those later.
Yeah, thanks to everyone who joined, and really appreciate all the questions. And hopefully this was helpful. I definitely, if you want, please do email me and Heather with sort of more questions as well. All right, should we just end there? Thanks again to everybody who joined. We'll make sure and send a link to the presentation and the slides to everyone who attended and to everyone who registered. I know there were a lot of people who had interest and maybe couldn't make it. Thank you. Yeah, thanks for all the messages in the chat too. It's great to see sort of people participating. That's wonderful. Yeah, I hope everyone has a good day. Thank you.